Welcome to the Anderson classes. Today we are going to cover the medical as well as the rehabilitation part. So today's topic is the feeding problems of child with handicaps. The baby's food intake is entirely controlled by reflex movements. There is a reflex chain reaction. Seek, suck, then swallow. Where the one regularly activates the next. Seek. Seek till mouth. Suck. Suck into the gut. Swallow. Swallow into the stomach. The problems in eating and digestion range from inability to suck, chew, or feed him or herself to problems in digestion and movements of the gastrointestinal system in the child with handicaps. Stopping up the feeding. A. Sucking. To suck, an infant must be able to purse the lip and then rhythmically raise and lower the body of the tongue, creating a vacuum. A number of problems may interfere with sucking in the child with the handicaps. First, abnormal muscle tone. The abnormal body muscle tone may force the child into extended position, making feeding more difficult and increasing the likelihood of the vomiting. Second is the lip retraction. It is more difficult to purse to make a seal necessary for sucking when the lips are retracted. Tongue retraction. The retracted tongue hinders the creation of a vacuum. Next is the nasal regurgitation. Liquid is ejected through the nose rather than down the pharynx, and nasal regurgitation caused by uncoordinated swallowing. B. That is a spoon feeding. When the infant begins to eat with a spoon, the tongue becomes more active than before. When the infant is sitting up, the tongue has to work harder than when he is lying down. Normally, the traveling period from sucking to spoon feeding is 4 months. So a number of problems may interfere in a spoon feeding in a child with handicaps. Second, the tonic bite reflex. The bite does not release and the spoon is stopped before it even delivers the food. Due to sudden closure of the jaw when teeth or gums are lightly touched. Reflexive tongue thrust. A food will be pushed out of the mouth rather than down the throat in an infant with handicaps. Next, hypersensitivity. An infant may be hypersensitive to touch of the spoon and even refuse to open his or her mouth. The next is the C, that is a swallowing. And child must be able to form a bolus and coordinate the contractions of his or her muscles to move food from back of the tongue to the pharynx and then down the esophagus. Poor coordinations of these muscle contractions may interfere with adequate food intake or increase the risk of the aspiration of food into the lungs. The next is the absorption. A number of the malabsorptive disorders may interfere with absorption. First is lactose intolerance. Unabsorbed lactose irritates parts of the gastrointestinal tract and causes vomiting and diarrhea. It happens due to inherited deficiency of enzyme lactase. Next is the cystic fibrosis. A normal absorption of the fats and the vitamins are interfered and lead to malnutrition and diarrhea due to insecretion of pancreatic enzyme. Then next is the celiac disease. This involves an intolerance of cereal products due to deficiency of an enzyme needed to break down the gluten contained in the cereals. The next is the constipation. This is due to an inadequate fluid and fiber intake combined with with uncoordinated muscle contractions and poor rectal sphincter control. So today in the interaction classes, medical and the rehabilitation part, we have taken the feeding problems of the child with handicaps. If you have any queries, please write on our email id andersonclasses1@gmail.com. Thank you very much.